I'm going to not read out verbatim, but I'm just going to give you some descriptions from a paper called Reflections on Filicide. It's from 2012, and I think it's a collation of a lot of studies on filicide, and the authors have put together two types of women, of psychotic women who commit filicide: the disorganized type and the organized type. And we can see if we think Clancy might fit into either of those types. But I'm not sure that it should even be in dispute whether she was psychotic or not. She may well have been, and it could have been her first psychotic episode, and that's statistically when most murders will be committed by people suffering psychosis, is in their first episode. But what maddens me the most is that there are the civil cases being brought against people, healthcare individuals and institutions who were there in good faith trying to help Clancy. And it's not always the nature of something like psychosis to be identified until hindsight, and disorders with a mood or personality, they can be really hard to diagnose. People are sometimes diagnosed with something and then receive a different or extra diagnosis months, years, decades later. These things change once more is known, and things take time. It takes time to work people out and to find the right treatment, and people have to work together with health providers to get the right care, to get the right pharmacotherapy and things like that. And a lot of things that are relied on are the reporting. Anyway, we won't start arguing with that. Let's just go through reflections on filicide first. So in the group of parents mentally ill with schizophrenia, bipolar disorder, psychotic depression, violence is different in nature. It's self-preservative. It's aimed at protecting from threat, okay? Because what do we know? What have I talked about in the past about threat? So power, threat, and meaning to do with psychosis. So what the studies are showing is that when people do murder when they're in psychosis, it is to do with protection from threat, no matter what that is. And so this is speaking specifically about psychotic women, okay? So the disorganized type. So extreme personality fragmentation, result of biologically based chronic mental illness and a destructive early environment. So, severe neglect, severe abuse when they're a child. So this parent's crime is the result of bizarre acting out where the infant is not perceived as human, but as a lifeless part object into which the mother projects unwanted, threatening parts of her fragmented ego. So when we talk about fragmentation in psychology, we know we're talking about someone that doesn't have a single continuous identity. It's a really damaged sense of self. So, we talk about dissociation all the time in relation to lots of different things. It's linked heavily to PTSD, to more so the personality disorders like borderline personality disorder. This, sufferer will have memory gaps, and it's difficult for them to make choices because different parts of them want different things, or they feel like a different person when they're around different groups of people, depending on the company they're with. So, so this is a person that, they're probably harder to treat long term or to get a good outcome. And, obviously having committed murder, they'll be in prison or psychiatric hospital, but, it would be hard to sort of make them well or functioning again, right? Because they're starting from a very broken place. With the organised type, it's a premorbidly more integrated ego. So this is a person that's achieved something educationally, maybe. We know Clancy did well in her studies, did well at school, in high school, and she's managed to go on and get a tertiary education. She had good work and interpersonal functioning, because she had friends. She met a man, married him, had a family with him, and she had a career before her children, So this integrated ego, it becomes temporarily but severely fractured, and the crime is organised into something as logic, but it's pathologically distorted. And they had a less chaotic childhood than the disorganised type, but all had a history of intrafamilial sexual abuse and depressed, inconsistent maternal care. So all of the disorganised types from the studies that make up the conclusions in this paper had that in their childhood. So unlike the first group, this group is very invested in their child, but it's in a pathological way. They look to their children to be objects of transformation, the repair of themselves. They seek a mother in their own child. And the Filicide Act comes when there's environmental stress. So this is when things happen in their life, because remember, this is about psychotic women who've committed filicide. So the environmental stress, it could be, a marriage breakup or just stress within the marriage. It could be severe financial problems, or even just, concern about finances, poor support combined with the mother's psychological vulnerability. So it leads her to feel alienated from the world around her. Her unbearable anxiety turns into depression and fantasies of ultimate annihilation, where the child is entrapped because of her enmeshed, undifferentiated relationship with the child. It's in this state of mind that this type of mother, starts to build the plan. One mother's statement illustrated this catastrophic dynamic very well. She said, "I didn't kill my child, I killed myself," but this organised group, they actually have, better outcomes. They're better able to understand the complexities of their crime, get to the core of things with psychotherapy and pharmacotherapy, and whether or not they're remaining incarcerated or not, but they can be sort of put back together, so to speak, as opposed to with the disorganised type. So, when there's this enmeshment and this undifferentiated relationship, it's just bad news for seeing children as an individual and really experiencing them that way, and not feeling like it sounds like they're saying there would be just big expectations that having children heals you, that you're going to receive this, receive love. And motherhood, parenthood, it's about being and doing and giving love, and not receiving it, and not expecting that, and not expecting the child to heal you or completely you. And that sounds very, very difficult, because very, very difficult for the children, because how could you live up to that? And you're not your own person, you're just extension of the mother, and you're supposed to be there in a role, and if you're not performing it, then it's catastrophic. So, being pre-morbidly integrated, or having that type of ego, so that just basically means, yes, before onset of the illness, the more competent, the more you're able to just sort of function prior to your illness, the better your outcome. More of an ability to distinguish internal thoughts from external reality. It's so tricky, right? Because, yes, Lindsay was, seeking help. She was saying things to family. She was maybe saying other things to the people she was talking about in health care that she wasn't telling family, and vice versa. But there are some factors that become dangerous, and, when put together with a first psychotic episode, can enhance the possibility of actually being someone to commit homicide. But, psychosis, okay, it's not a thing as such. It's not, it's a collection of symptoms affecting the mind. So where you've got some loss of contact with reality, or indeed, full loss of contact with reality. It can involve delusions, okay? So those are the false beliefs that the people on radio are talking about you, a neighbour is spying on you, that you're being sent messages through things. So, you're driving along the road and you see a street sign with a certain name, and it's as if it was just put there for you to get the message that it's giving. Incoherent speech, nonsensical speech. There will be a lack of eye contact. Facial expression can be, very bland. These are sort of in the what we might call negative expression, negative symptom. Inappropriate behaviour to what a situation would ask for. Trouble thinking clearly or logically, withdrawing socially and spending more time alone. Different behaviour like suspicious behaviour, paranoid behaviour, and uneasiness around others, except for maybe those that you might manage to trust, but it's obviously why people might spend a lot more time alone. Never underestimate what sleep means to psychosis or just other mental illnesses. Disruption of sleep, difficulty falling asleep, reduced sleep time, confused speech, trouble communicating, a drop-off in performance at work or, in education if people are at school, emotional disruption, anxiety is a big one, just lack of motivation, difficulty functioning in general, or even catatonia, and, can even behave in very confusing ways and start to harm themselves or pose a risk to others. And obviously psychosis is a medical emergency because of this, But it's not necessarily diagnosed just like that, right? Typically, symptoms appear before people are receiving treatment for it for a year. It can be a year before people start receiving treatment for it. Obviously, the earlier they receive treatment, the better their recovery can be. Treatment might be antipsychotic medications, specialist care team, individual and group therapy, and support with being able to return to educational workforce. I mean, these are the things that people were trying to put in place for Lindsay Clancy. I'm not sure how forthcoming she was, and they can obviously go by what they observe, but it's also very much based on self-report. Now, when psychosis is drug-induced, you can have an episode that's as little as a few hours long, but often psychotic, someone is in a state of psychosis, and it could be waxing and waning, but it can go for months at a time, okay? 25% of those people have really low insight, so they do believe their delusions, they do believe the hallucinations are real, and other people are aware of it, but the awareness can wax and wane just as other symptoms can. So often you're experiencing psychosis without having any diagnosis whatsoever, because these things are very hard to diagnose, and they're not often diagnosed correctly the first time, particularly personality or mood disorders. Lindsay did have severe depression disorder diagnosed, GAD, and she was obviously having issues with sleep. She was highly anxious. So should they have been more aware about the possibility of a psychotic episode? Possibly, but what other symptoms were being reported to them? What did they not get shown or told? It's a tricky one, right? And I think they were acting in good faith. And it's complicated. There's so many variables, and should people's livelihoods and lives and careers be brought down by Pat and Lindsay's civil cases? It's, I don't know, is it very entitled behaviour? Is it correct in Lindsay's case, maybe? Who should be taking accountability and how much? You know, most of the murders committed by people in psychosis, it's not the most, but it's a huge chunk. It's the majority of it drops down a lot after that. 40%, up to 40% of people are in their first episode of psychosis. But what can be factors that make it more dangerous that they'll be violent and commit something like this? Substance use, like alcohol. Now, was Lindsay, Patrick could give us more insight into this, was 1 to 2 drinks a night? Was it actually 2 to 3 or 3 to 4? And when you combine that with the medication, that's dangerous. It's dangerous anyway. A delay in recognizing and treating initial symptoms. Now, if she was in psychosis, well, that's happened, but it's not like what happens is you ring up a healthcare professional, you have a meeting with them, or you do a video chat, and there you go, it's exactly this, and here's the right medication. That is so out of touch. Okay, that's really ridiculous and uneducated to imagine that that's possible all the time, or that it can happen or should happen. It's just not like that, okay? and then the non-adherence to treatment. So, I mean, all those three things, yes, might have been involved, and Lindsay Clancy could have been in psychosis. Does her psychosis mean that somehow other people are responsible for what she's done? The problem, like, how you can look at it though, right, is, Lindsay was solving a Lindsay problem, okay? What was Lindsay really wanting? Lindsay was worried about work, marriage, being her old self. She did express some concern about how she was able to mother, so that is there, but really the things that were getting in the way and would remove this problem completely is Lindsay Clancy being without her children. She'd be able to go back to work and she wouldn't be worried about who's raising her child, who's who's feeding her child. She wouldn't be worried about being a good wife to Patrick, because that relationship could change again. She was worried about getting pregnant again. So without being on birth control and having that sorted out, she was worried about not having an intimate relationship with Patrick and how that was affecting his thought about her. And I think she was scared of him being unfaithful or even leaving, whether that's rational or not. And she said she'd never be the same again. Well, of course not. But what solves all of that is eliminating her children. It just puts it back to that status quo, back to that, pre-child state where these concerns didn't exist, and she didn't have this high anxiety, and she didn't have to worry about money, and she didn't have to worry about not being able to keep her husband happy and that sort of thing, right? It's so warped, but it could be that, and that would sort of tie in too with the organised type who just have this enmeshed, undifferentiated relationship with the child, because they're not individuals whose lives matter. What matters is Lindsay's life and her survival, okay? And whether this is psychosis or not, she's performing the act for herself, and to take back to self. It's not, that's why I got very grumpy. It's not altruistic, okay? It's not altruistic. That is a retrospective planting. That's what they're trying to do, is retrospectively make that somehow appear in her history and in the care notes and things like that. Lindsay wasn't being altruistic. She was caring for herself, She didn't think that the children were possessed. She did think Dawson was really, really difficult. She couldn't manage him, and she wished Callan was her first child so that he, I don't know where that leaves Cora, but it wasn't an altruistic, because she wasn't having delusions, okay? Lindsay Clancy wasn't having delusions. I mean, are these going to suddenly appear? So she wasn't imagining that she was saving her children or anything. I mean, she might have selfishly thought, well, she actually expressed it, didn't she? To kill myself, I just need to kill them so I can just then kill myself. They're part of her. They're enmeshed, and so if Lindsay goes, the kids go, right? but she wasn't having these delusions or anything. She's saying she was having hallucinations, but what were the hallucinations telling Lindsay Clancy? Just, it was more like just intrusive thoughts and fears, very, very normal fears, right? Not these, there's nothing irrational about it, it's nothing bizarre about it. It's just perfectly normal to be concerned about the breakup of your family and what would happen if you went into treatment. But if, you know, I mean, she was perfectly able to sleep as soon as she was removed from the children. I can kind of see how she, you know, in a distressed, in an in-crisis state, how ridding the children is the answer to her prayers. She spent a few nights in McLean where she slept every night. She didn't have the sleep problems. You know, it's, we don't envy the jury, do we? Does anyone who might listen to this envy the jury? But, you know, obviously Red's playing games and the district attorneys have got their own game plan. I mean, both sides are just doing their job, right? But we could all sit here for hours and pick apart each of these witnesses, particularly the ones that Red has brought. And, you know, there's some buffoonery and some fuckery going on, right? There's some warping and messing around and retrofitting, and there's some plain lying and things going on. You know, which isn't good. It doesn't help people feel compassion for Lindsay Clancy, right? You know, if this was a, you know, high-performing woman who just suddenly felt like a failure, she I don't know, you know, it's just hard because, you know, when I say, oh, look, is she an anomaly or is she just this garden or common psychopath? That the, you know, the anomaly coming in as, okay, so what percentage, I can't spell, what percentage of what percentage of what percentage is Lindsay Clancy? She's just comes down to an infinitesimal, you know, she's in a little group, all of her little own. If you needed to grab all the bits and bobs that put her into being completely unaccountable for herself, you know, and because just briefly and very not completely, what I mean by that, for example, is her postpartum psychosis didn't kick in as early as would be very common with women who suffer postpartum psychosis. It gets less common as time goes on, possibly considered within the year, and this is why in some countries, the Commonwealth countries, UK, Australia, New Zealand, typically if a woman commits infanticide, it's an instant manslaughter charge, not homicide charge. They just assume that you just have to be effed up from hormones and lack of sleep and everything so that you've had a psychotic episode for whatever length of time, and it's part of that, which I think is terrible because many of those women getting off with a manslaughter conviction, well, they're just bastards. It's neglect, you know, it could be neglect, cruelty, abuse that has killed that child. And those things don't take long to kill a younger infant. If you think of Shanda Vander Ark, is it, who, you know, what a murderous wench. But, you know, the bullying and the systematic abuse neglect, depriving of food and just physical abuse and emotional abuse. It takes a long time to kill, but a teenager, but it will kill them eventually, right? And yeah, so I don't really know if I go along with that. She has killed 3 children, and when it's a multiple homicide, it is, that does lean towards psychosis rather than just singling one child out for abuse and murder. But, it's a long time frame. She had supports. She was receiving treatment. Just because it's not necessarily the right treatment straight away, often that doesn't happen, and she was doing all of these 3 things here. So anyway, I'm not describing it very well. I'm going to go because my voice, and if I start coughing, that'll be the end of it. But what do you guys think? I mean, I'm not sure. I'm in 2 minds about all of it, because for the healthcare professionals, they were trying to act in good faith. When you've got the civil suits, neither of the civil suits, including Nurse Paul, now they might be able to get away with an explanation that, well, it was only the one time that Lindsay saw, but hey, if they're expecting that someone should just be able to find a diagnosis like that and treat them straight off the bat, then why didn't Nurse Paul do it? It was people on her team that she left that were trying, if Nurse Jalotta was imagining maybe this is a bipolar, disorder situation. But it's truly bizarre because Lindsay has been prescribed medication in the past. Now we don't even know if she took it when she was younger, when it was prescribed for being feeling stressed and anxious about public speaking and just starting her role as a nurse and things like that. We don't know. She certainly wasn't compliant with the medications. She just did not take them. And it does appear that she was shopping around a little bit. She would have known that medications can be cross-referenced in systems and things, but she liked the benzodiazepine, but she didn't give Dr. Tufts a chance to, hey, let me manage that, because it is just so important that you get sleep. So get the sleep. Let's worry about the possible addiction to benzodiazepine later. We will taper you off. It's, so, I mean, do we just say, look, regardless of what happened and what got her there, the fact is that she was in psychosis, so she's just 100% not responsible. But I fail to see how that means that her and Patrick should each be bringing these civil suits against people. I mean, is it really malpractice when it can take time, when people might normally have these symptoms that always are visible in retrospect to a practitioner? They should be able to look back and say, oh my goodness, yes, there were times when this was happening and that was happening, and this is Lindsay's effect. I mean, I do look at photos of her and see she I think her self-care had declined and things like that. She was really pushing herself to go to the gym, but I think she was just desperate to keep in shape. I mean, you do feel better when you exercise, but I think she wanted to keep in shape, be slim, be seen as the fit, yummy mummy. She was irresponsible when she was taking gummies, which I guess is why I made that, titled a video "Gummy Mummy." She wanted, she wasn't being open. She wasn't telling her practitioners. She wasn't disclosing the things that she should have. She was definitely highly anxious. She was stressed. And if she was having those auditory hallucinations, it's concerning. But it's not a given. She was getting care. She was doing it quite regularly, but again, she wasn't doing the treatments that were prescribed, which was therapy, which is all part of the healing and the care for someone like that. And in therapy is where it would have been more likely to have been able to be predicted or diagnosed, and she wasn't doing it. So if something's not happening, how is it the practitioner's issues? She only had 2 therapy sessions, and I think that's concerning. She wasn't taking her medication, and yet she told Women and Infants Hospital that she made out that she was taking all of the medications, and so they might have thought, well, she's very medicated at the moment, this isn't what we're about. If she'd been truthful, she wasn't over-medicated. She would have been in a program there in one way or another, an outpatient. It's hard too because, she had, look, there are people, because a lot of these places, when they, when the papers talk about lack of support and poverty and things like that, that certainly wasn't Lindsay. But sometimes your perception of things is what matters, and especially for someone with maybe a mood disorder or a personality disorder. And, Patrick did go skiing on the day. I didn't realize this. I thought it was after as well, but he's gone skiing on the day that she's gone to the women's hospital and things like that. And, he was very able to manage his life, and his mother-in-law as well. No one was really pushy enough, really. Sometimes it takes, you can't ask, you don't know to ask, or you can't just be upfront. You need someone just to swoop on in and just be that person that understands that you just come on in and do and be the help. She shouldn't have been left alone. That is on Patrick. Patrick knew about the thoughts of suicidal ideation and homicidal ideation. She shouldn't have been alone for one moment with the children. And that's on Patrick. And his mother-in-law, being the one that lives closer and being a nurse, did not insist on staying. I feel like, just don't worry about being interfering. You're trying to protect people. You want to get through a difficult period, and I feel that is sickening. So now, she supports Lindsay. How is that not about the civil case? How is it not all getting too entangled with the civil case? And, because his parents lived closer than her parents and should have known, or if other healthcare professionals should have known, why didn't they? Patrick's sitting in on sessions with Dr. Tufts or anybody else, for example. Well, look, unless he's there, I don't know what sort of advocate he would have been for Lindsay, and or if he was just sort of there, but it was affecting how she acted or what she said to the professionals. But if he was there, it should have been because, look, I need Lindsay, I need to know that they know what you have told me, what you've told my mother, or maybe what you've told your own mother. about these homicidal thoughts or thoughts of euphemistically harming your children, because things could have gone a totally different way. And there's always the angle of, well, you know, obviously this could be constructed by Lindsay. But, you know, it just does, I don't know, I don't want to seem callous. I do think she was in crisis. But it doesn't mean that she didn't think that killing her children was the answer to all her problems. Whether in psychosis or not too, right? And I am having a hard time getting around that. And it does concern me that people tend to think that all psychotic people commit violent crime. Yes, slightly higher than gen pop, you could say, or undiagnosed people, or you could say, committing homicides, but it's really insignificant. In fact, it's such an insignificant figure that in the big United Nations global study they did on homicide, they didn't even have a category or mention for people that were psychotic. And people in psychosis are more in danger from others, or, you know, in danger of harming themselves. And I don't, you know, we shouldn't stigmatize psychosis, and we also shouldn't medicalize murder. And I think that's a danger here, okay? Yeah, so I could waffle on forever, but I'm not sure how the jury's going to go. A lot of people are saying it could be a hung jury, or maybe even a mistrial. Could be.